Hi, everybody. This is Dr. Ed Park. I'm recording a lecture I did at the American Academy of Anti-Aging Medicine in Las Vegas. I'm doing this because the first time I was a little nervous. I didn't bring my computer, so I hadn't seen my slides for 5 days. There were 300 people in the audience, and my mom was there, and the discoverer of clinical use of exosomes was there as well. So here's my chance to redo it. Hope you enjoy it. What we see on the slides are exosomes being released from a multivesicular endosome. That's how they're produced, and that's how they're released in reality. The lecture is just an amuse-bouche. If you've ever paid more than 150 bucks for a meal at a restaurant, they attempted to mollify you with these little wonton spoons full of treats. It's just an amusement for the mouth. It's an appetizer. I'll give you the link for the full meals later. The disclosures I have are that this is not a paid for talk. It's a CME talk. I was given no consideration nor promised any. And I am a distributor now for a particular exosome company. And I do have an online training course teaching you how to use exosomes as a doctor. So what are our learning objectives? First of all, we're going to talk about what is an MSC exosome, what's the experimental evidence to suggest that it would be helpful. How does this fit into the evolution of regenerative medicine? What kinds of patients and indications have I been using them for? And what are the potential downfalls? So I do believe in anti-aging. My first experience at A4M was actually doing a couple of lectures, I think in 2012, about telomeres. When I found out that my dad was sick with cancer at age 37, that was back in 2004, I Googled aging, and I quickly intuited that telomeres were important. I wrote a screenplay about that, a sci-fi one, did a lot of research, and started taking a telomerase activator called TA65, which I think has kept me young for the last 15 years. Every year I've taken that extract, and it's kept the black hair on and the reading glasses away. So I really do believe anti-aging is a real thing. My background is I trained at Harvard undergrad, and then for residency at the Beth Israel Hospital, also Harvard was affiliated. I went to Columbia for a PhD, MPH, Master's in Public Health, and my medical degree. And unfortunately, my dad did succumb to the glioblastoma in his head, which was, obviously a painful journey a lot of families have taken. I wrote self-published a book called Telomere Time Bombs, talking about my ups and downs, my sort of TED Talk lowest moment is all in there. But also with wonderfully simple cartoons, I explain the telomere theory of aging, how all chromosomes shorten, mutate, and cause disease. And I think it's an important book. If you want more of a handbook on how to be human, The Telomere Miracle was commissioned by Hay House, and it really talks about the science and the practical aspects of doing things that are healthy for you, such as deep breathing, sleep, exercise, supplements, etc. But we even go into mindset, flow states. It's a good book to pick up, very readable, good illustrations, and also scientific citations in the hundreds. So, like I said, I started with anti-aging with telomerase activation, and this is me on the left back in 2000. I had a 1-year-old son at that point, and 33, private practice OBGYN, very busy, very stressed out, working way too much. And after I took the telomerase activator, I lost like 20 pounds, and my fatty liver, hypertension all went away. In 2010, I was 3 years into the telomerase activator, still looking pretty young. My son is now 10 years old. They're in, I think, somewhere in Southeast Asia. I'm traveling. The boys are now 13, 17. I'm 49. Above, well, we see just 2 months ago at the Museum of Modern Art, and the boys are all grown up, 19, 23, and I'm 55. My mom is above there at 85, just a couple of months ago, and she, although not taking as much telomerase activation, is a big believer in the exosomes and has had 31 treatments. So let's go down to first principles and talk about what aging is. So in the Hindu religion, there are 3 gods which represent 3 processes. So the first would be Brahma, the creator god, Vishnu, the maintainer god, and Shiva, the destroyer god. And I believe that if we think deeply about aging, it boils down to these three things. Creation being embodied by the stem cell. A stem cell is a cell that reproduces asymmetrically, meaning one perfect mom and a differentiated daughter, and it has telomerase activation, which means that it is, in effect, immortal. Even though it's immortal, it can have shortened telomeres from telomerase dysfunction and cause mutation. And that's why I created this chart to your left. And it says that if you look at the literature for all the outer ring diseases, such as Alzheimer's, cardiovascular disease, macular degeneration, weak immunity, cancer, wrinkles, infertility, diabetes, throughout your body, they look like different diseases. They're actually originating from the same process, which is telomere shortening. Is this accounting for all of the disease? No, but the majority probably. And it's because you look at these organs, you find that the stem cells or the differentiated daughters in these organs are all depleted. They come from cells with shortened telomeres. This is a constant process. This is the lack of maintenance, lack of Shiva. And then when a cell, for reasons explained in my books, has mutations, it kills itself, causing further depletion or Shiva destruction. This is borne out by this Dutch lady who was studied a couple of years ago, and she in fact had a bone marrow biopsy showing only 2 variants of immune cells, and allegedly there's about 20,000. So her repertoire of blank keys, if you will, her ability to respond to new immune challenges was exhausted. And I think when we think about aging, that's really what aging is, depletion of your available stem cells. At the RADFest, someone asked me what would be the greatest intervention. I said, 20-year-olds should be endowed with a bone marrow biopsy, and they should be able to store their stem cells for the rest of their lives, and then they could do replacement parts. But so far, no one's thinking about that. So what this Dutch lady, Mrs. Van Andel Schipper, told us or taught us is that, yeah, your immune system is key. It gets depleted, and that shouldn't surprise us. Next to me, an illustration of generally what I'm discussing, which is that the local stem cells become error-ridden. And sure, if they're depleted, they can be replaced by the mothers. But we see for later on from the rat study, which we'll discuss, that when you have all these arthrosis, which is a burnt out knee, it's not an inflamed knee like arthritis. Arthritis leads to arthrosis. So tendonitis leads to tendinosis. Osis means that the organ tried to copy its way out of sickness, and it ran out of the ability to copy, just like Dutch ladies' bone marrow ran out of available Brahma or stem cells. So I submit that it's one disease with many faces in every organ. We have depletion, dysfunction, and inflammation, which I hope to talk about in May, part and parcel of the aging process. And I'll be applying to the A-Forum speaker role then as well. So all around the body, your genes are silenced, your cells are leaking. I'm sorry, your genes are silenced, and it leads to senescence and a poor cellular milieu. Indeed, if we think deeply about disease, and the next slide, we'll figure out that disease is probably an emergent phenomenon of the milieu. Ooh, it's not the next slide, I lied. You'll have to wait. Okay, so what is a MSC? It's a mesenchymal stem cell. It's actually a type of amoeboid primitive mother stem cell that lives in all these small vessels. It sits there like that blue amoeba, and when there's inflammation or some call for repair, it'll migrate into the organ out of the blood cell, differentiate, copy, maybe even signal other stem cells to dedifferentiate and copy, and it'll shut down inflammation and start the regenerative pathways. It has multipotent differentiation. In fact, one of the ways that real stem cell biologists test whether they have MSCs is to cause them to undergo stepwise differentiation. So they have certain surface markers, but they're immortal, although they do degrade from multiple copying, telomere attrition, epigenetic modification. So you can't leave them for months in culture, they get bad. They have asymmetric replication, they have immortality, relatively speaking, and they have multipotential differentiation, meaning if you give certain substances, you can make an MSC turn into bone or cartilage or some other tissue, and it's like a cookbook. Their main role in the body from birth to death is to heal us. It's the number one healing mechanism. If you hurt yourself, this is how you'll heal. And it does this in two ways, which are the Th1 to Th2 phenotype, which is a kind of immune expression, and the M1 to M2 macrophage, which is a regenerative rather than an inflammatory macrophage. So Willie Sutton, the famous bank robber from the early 20th century, was asked, why do you rob banks? And he said, well, because that's where the money is. And this is where the money is. If you're going to copy one exosome, this is probably the most useful one because it's the one nature uses to heal us. So what is an MSC exosome? Well, it's a message in a bottle. And until about 15 years ago, nobody even knew that these existed. It's because you can see next to me the scale, hydrogen atom up to giant sequoia. The human egg is about 100 micrometers. A normal cell is about 10 micrometers. A bacterium is about 1 micrometer. HIV is about 100 nanometers, which is the same size as these exosomes, same size as the Moderna Pfizer vaccines, same technology. So they were just not in a range that people were even studying them. Could they have seen them with an electron microscope? Absolutely. Why weren't they looking? Because nobody knew that they existed until 15 years ago, sort of like planets. So why do I say that? Well, look at a textbook from before 15 years ago, and it shows everything we learned from 50 years ago in high school, which is that the nucleus is connected to the endoplasmic reticulum, which is connected to the Golgi apparatus, and this endosomal network is all tasked with releasing something into the bloodstream for communication. But look, they got these little purple things called proteins. That ain't how it works, folks. As we can see from the opening slide, the body is not packaging proteins and secreting them. It's packaging exosomes. So that was not a good mistake to make. So actually, in the bathwater, if you have stem cells in culture, the bathwater is where the exosomes are. That's how it's trying to send its messages out in bottles. And no one even looked at that until 15 years ago. Wow, that's amazing. How could we not have known? Especially suspicious because around that time, they won a Nobel Prize for clathrin-coated pits, which is invaginating proteins. And so they knew that the cell was sucking in the stuff around it and it's extruding out. But for some reason, no one really thought deeply about what was going on, and it was not even looked at. But starting about 15 years ago, they started to look at exosomes, and surprise, surprise, everywhere they looked, they found diseases associated with good or bad exosomes, and they started to say, well, this might be how cells communicate. In fact, that's probably a big miss in basic cell biology. So what are they? They're 100 nanometer phospholipid bilayer spheres. They have proteins, mRNA, microRNA, which are blocking RNA. There's no surface MHC antigens for immune rejection. That means your body doesn't know it didn't make these great exosomes because they can't be rejected, unlike allogeneic stem cells. And again, to reiterate, they cause dedifferentiation and proliferation of your local burnt out stem cell niches, shifting your phenotype from inflammation immediately to regeneration. Oh, this picture on my left is it's cluster of differentiation marker 9, 63, and 81. These are the canonical or commonly accepted proteins that are on the surface of true mesenchymal stem cell produced exosomes. The contents within can vary. Nobody really knows. They're like musicians singing notes in harmony. Nobody really knows what they're singing. So next to me, we see a candle that used to be on my porch, and it would melt, and there was water and wax, and occasionally pine needles would get embedded like proteins in the waxy membrane. So an exosome is a waxy bubble sphere, and the water is protected in the contents. It's a message in a bottle. That's what it's all about. Hydrophobic, hydrophilic. I bring up the planets because when I was a kid, they said there weren't any planets because we can't see them. And I thought, well, that's weird. Like, we live in a special solar system formed planets, but nowhere else do they exist because you can't see them. I don't think the intuition checks out on that. Now NASA is pushing this idea that they have 5,000 confirmed exoplanets. I grant you that they are not seeing them. This is an artist's rendition. They're using inferences from gravitational stuff and, I don't know, light waves, but good for them. Who knows? I don't believe what they're saying anyway. Do I believe that there are exoplanets? Absolutely. Can they detect them? Yes. But they got a lot of explaining to do about certain things. Anyway, so if we look at how people communicate, there's FedEx packages, there's phone calls, emails sent across the internet in internet packages. The package, every little thing that we're doing has a beginning and end, saying where it's from and where it's going. And so this is how cells communicate with little packets or exosomes. The musical analogy serves well. Look at these little chamber music artists, these old maybe Dixieland or rock band guys, and then we have ballroom dancers. So we can infer from these pictures, because we're human, what songs they're singing, what music they're playing, what's in their repertoire, although we can always be wrong. And the point being that cells are alive. They have a sort of innate programming, yes. They have a certain intelligence, yes. But even people who take care of stem cells refer to them as being tuned. You tune them with high oxygen, low oxygen, all these things, even light and sound can probably affect how these cells feel, what songs they're going to play. And so, although we have the ability to do RNA omics, proteinomics, and study using advanced, usually chip-based technology, they can analyze the identity and the quantity of every single known mRNA, every single known protein, and give you a readout. That does not explain the music, and it doesn't explain the dancing of how the cells will respond when they're given the signal to produce certain proteins or not produce others. And so that's important, that the song is in the bathwater next to me. And no one even studied that until 15 years ago. When they started studying it 15 years ago, there's been, I don't know, maybe over 10,000 articles. This is a rendition. You saw a drop after 2021 of the PubMed articles. That's our major scientific peer-reviewed. There were 5,000 articles in 2021, and that was basically zero 15 years ago. So has been exponentially rising. And if you go and look, unfortunately, it's very reductionistic. They look for a single note, like let's just say a certain protein that someone is a PhD in. They might look for that and find it. Well, hurrah. But the actual complexity of it is more like they're looking for an F sharp, but we're looking for, F major chord in a sequence of a 28-minute Stravinsky song. It's complicated. But what is not complicated is the idea that disease and health and everything we do can be mitigated by these songs, these messages in a bottle. To wit, there's a study here on the upper left. If you have hepatitis, liver cirrhosis, you take the exosomes from that person, they can cause disease in others. And in contrast, if you're getting better from cirrhosis and you give those exosomes, they can help to heal somebody with cirrhosis. Same with breast cancer transformation, same with lupus, same with every other disease. So just like with the telomere story, where people started looking for shortened telomeres and they found it in every disease, you can find certain phenotypes of exosomes and their proteins expressed in other diseases. Does that mean we're experts in music theory or we're musicians or even dancers? No, we will never understand this language. The best we can hope to do is use biomimicry. And the more reductionist an approach we take, the less we actually understand. It's not about the F sharp, it's about the effects that all these dozens, and it is known what's in these MSC exosomes, what these dozens of notes signify in terms of harmony, melody, and movement. All right, let's go to 3 studies in rats, giving them catastrophic events. This first study, they gave a middle cerebral artery occlusion and then added either exosomes or no exosomes, autopsied the rats at 28 days. And the rats before the sacrifice had greater functional and pathological recovery, as shown by these pathological slides. So the exosomes were a positive intervention for mitigating damage after an induced cerebral vascular accident. Likewise, here's a study, bone marrow derived mesenchymal stem cell exosomes, same thing. They went in and they did surgery on the knees, scraping, destroying the knee cartilage and the underlying bone. And the sham surgery is a placebo, doing nothing. That's on the left picture, left MRI. When they just gave phosphate buffered saline, again, kind of a sham intervention, the knee was mangled and the regrowth of the cartilage was minimal there. But when they put exosomes in addition to doing the mangling surgery, the knee cartilage grew back, the MRI grew back, and indeed what we saw was a rise in the collagen type 2, which is the fibrocartilage that we need for a healthy joint. So this proves pretty clearly in an animal experiment that these can regenerate cartilage. What we found interesting was that the collagen X, which is bad collagen, which is part of the hard osteophytes or the calcified tissue in an arthritic joint, that was decreased. And predictably, the M1 to M2 macrophages also increased. And what they also found was that the senescent phenotype, meaning old, even though these are new rats, they found that arthritis was similar in every way to aging. So what does that mean? When you overuse your knee, overuse, over repair, overcopy, the telomeres shorten and you get a senescent phenotype. They're in an arthrosis state, meaning they've copied too much and they're no longer able to copy. So take home lesson, increased growth, decreased inflammation, less collagen X, and all good. Finally, they gave mice heart attacks, tying off their coronary arteries, and look what happened. If you give a sham surgery versus saline plus sham, a real heart attack plus saline, and you give MSC exosomes with the heart attack, the recovery of the heart muscle was greatly increased. So this can help to heal a heart attack. After 7 days compared to sham, the exosomes were much more regenerated, and indeed the left ventricular function, the area of infarct, and the measure of cell death were all improved. So what does this represent? People often ask, what's the difference between a stem cell and exosome? Well, that's like asking what's the difference between a musician and a song. A musician makes the song. The song is comprised of many notes, like proteins, mRNA, but a song is not alive. A song is merely notes in rhythm, in sequence, in harmony, in order. Yeah? So that's the difference. Cells are alive. They have DNA. They have machinery to produce energy, to produce exosomes. They can be programmed and reprogrammed. Exosomes are just tiny. They're about 1/3 to 500th the diameter of the cell, and they are merely messages. They're little internet protocol packages sent across the wires or the airwaves. They are not alive. So if we look at the evolution, this is the canonical understanding of evolution from some kind of primitive hominid low to the ground to upright walking. We see, over 100 years ago, they were doing prolotherapy, which is basically causing some kind of damage or inflammation. That took the form of hypertonic dextrose to desiccate and lyse these cells. What's persisted in the orthopedic community is microdrilling of the cartilage, which is actually quite good. Put a bunch of tiny little holes in the knee cartilage, and it will, in response to healing, it'll grow new cartilage. But the whole basis of this was inflammation and creating mesenchymal stem cells to come and do their job. Okay, someone thought of doing PRP, which is this platelet-rich centrifuged area below the platelet poor plasma and the red blood cell pellet below. If you spin the whole blood, that's what you get. So they took this PRP. It has platelet-rich growth factors, or at least PDGF, platelet-derived growth factor. It has proteins. For whatever reason, it's like a successor to prolotherapy. It causes inflammation, which causes MSCs to come in. Remember I told you the MSCs come in from the local blood cells? This is mimicking your birth to death process. So prolotherapy was old, PRP is a little better, and it works, but it works by inflammation because the docs say you can't take Tylenol, Advil, aspirin during the time of pain for the first week or so. So it's relying on inflammation to recruit the MSCs. So next we had these MSCs, but it was a mixed blessing because, of course, if you're taking it from yourself, that's one thing. It requires an invasive lipo or bone marrow biopsy, but it's not going to be rejected because it's from your own body. It doesn't have the incompatible histocompatibility antigens. But if you take it from someone else, every study pretty much shows that it's not going to really live long because your immune system will reject it as foreign. It will overwhelm it, destroy it within 3 to 5 days. During that 3 to 5 days, it's probably secreting billions of exosomes and having an effect. Is there engraftment and chimerism? Probably. If you combine it with MSC exosomes, is there even more engraftment? Perhaps, but we don't know. We do know that they're immune cloaked or immune suppressive and that they produce exosomes. So why not just, if all these things are just bringing in stem cells to produce exosomes, why not just produce exosomes? And that's what we're doing. This is nature's #1 tool for regeneration. In my practice, I feel like it's been a predictable dosing, predictable response, incredibly safe, and really just only one untoward reaction, which could have been happening with any procedure. So it's like this massive Swiss Army knife. It's a tool that can be used in many different ways, many different areas. And indeed, your mind will be blown if you knew the kind of things that we're seeing. It's been a privilege since 4 years ago when I first attended the A4M lecture and the doctor described his motor vehicle accident and his rapid recovery just in 4 weeks from broken ribs, ankle, and collarbone. That was the moment where my intuition said, okay, this is incredible healing. I need to try it. And that was the life-changing moment for me. I hope this lecture will be somewhat of a life-changing moment for you, or at least your loved ones, because for now we have this ability to heal people. I did my knee first to see if it was safe. It healed my meniscal tear. Achilles rotator cuff also improved, although I've had to repeat that twice in the last 4 years due to re-injury. And I started experimenting on my close patients and my mom. Mom's had 31 treatments and is largely pain-free at this point. I would say there's about a 70% positive response rate. And again, the results are truly amazing, especially with some of the neurological stuff that really should never, ever get better. This is old data. Right now, we're over 300 patients, almost 600 encounters, and 1,400 injections. As you can see, elbow penis, very rare in our treatments, but we do more ankles. We do spinal, meaning intrathecal, wrist, hips usually with ultrasound right into the joint, although hips could be defined as some of the other muscles that are sometimes torn. Arterial or periarterial injection, nerve injections, epidural, facial, shoulder, knee, very common. Other MSK injections, tennis, golfers, elbow, Achilles tendonitis, plantar fasciitis, rotator cuff. Fingers are common, and the numbers are high because there are a lot of fingers, And we do the nose, nasal for brain, for cognition and neural inflammation, and also IV. So as we close down, let's talk about the FDA, because that's the other common question. First, why are these different from stem cells? And what about the FDA? Well, our current standard of care is primum nolo contendere. Usually it's the Hippocratic Oath is above all, do no harm. But in this case, our standard of care with regard to the FDA is what they plead in court when you say, I am guilty, or I don't contend. Nolo contendere means I do not oppose. And we should perhaps push back on some of these recent overreaches of our government. But that's another topic. Why the fig leaf? Well, when we toured the Vatican Museum, we saw these fig leaves. There was one pope who didn't like to look at genitalia, so he ordered them all cut off. And afterwards, another pope said that was unsightly, so they used fig leaves to cover the damage. What do I use this analogy for? Well, because if you gave someone a recommended COVID mRNA therapy for COVID protection, you've already used exosomes. These are the first 2 and only exosomes approved by the Food and Drug Administration in, well, record time, warp speed, if we can borrow a phrase. They're 100 nanometer synthetic phospholipid bilayers with a synthetic, not even real, but a synthetic mRNA spike analog protein or message. So it causes your body to produce spike proteins. The animal trials were concerning. The desire to hide the preliminary data for 70 years also concerning, although no one even has read it. The forced vaccinations, contrary to the Nuremberg Code, were concerning. People losing their jobs over not wanting to try this experimental vaccine. And the vaccine adverse result database is dubious as well as alarming. And there are many countries in the world now that are reversing their extremely aggressive exosome therapy mandates. Look at our standard of care with low back pain, disc disease, complex disc problems, ligament problems, low back pain. The sort of knee-jerk reaction is to give epidural steroids. Well, let's look at that. From a Cochrane review standpoint, it's never been peer-reviewed. It's never been, in fact, the peer review said it was not recommended. It is never FDA approved. It obviously should cause worsening symptoms in the long run because high-dose corticosteroids cause chondrotoxicity as well as ligament laxity. So why wouldn't things get worse? But it is paid for. It's standard of care. It is dangerous, and it is recommended. So there you go. No lo contendere. Everyone gets them, even though they know they're not helpful and probably hurtful. The black box has covered its own privates by saying that injection of corticosteroids into the epidural space of the spine may result in rare but serious adverse events, including loss of vision, stroke, paralysis, and death. And there are 6 countries where they won't even allow it. So go figure. You know, are you trying to help people? Are you trying to stay out of trouble? Are you trying to do both? Or are you trying to hurt people? So we have 2 exosome therapies that could be potentially outweighing their benefit with their risk. And we have standard of care for low back pain, which is by all measures not working and harmful. So when it comes to Willie Sutton, and that's where the money is, well, if you were going to copy one thing from nature, it'd probably be MSC exosomes. What are the pitfalls? Well, there's 3 things I always think of in terms of malpractice. And the 2 legs are deviation from standard of care, unavoidable in this instance. Number 2, a bad outcome, extremely rare. I only had 1 bad outcome in 1,500 injections. It was from a knee infection, which in all fairness could have occurred from a steroid injection or BPC 157 or what have you. The most important is malice. If you don't have good communication, and we go a lot into this in my course, there needs to be adequate informed consent, autonomy, beneficence. You need to be looking out for the patient's best interests. They need to have open lines of communication afterwards. If a patient has malice, they will sue you. If they do not, they usually will not. The biggest problem that I have or pitfall is attribution bias. Patients will get half better and they'll say it didn't work, whereas some patients will say, well, it got half better. I need another shot to get 100% better. So you need to manage those expectations. You know, like my meniscus in my knee is all better, 1 treatment, 1 and done. There's a Hungarian guy who's leaky gut, was treated 2 years ago. He's been fine since. But things that are repeatedly injured, like my rotator cuff in yoga, my Achilles from yoga, they've gotten re-injured. I'm not taking it back up to 100%. I might be taking it from 30 to 50. But again, it's just a tool that you have to heal when it's re-injured as well. The Th2 phenotype goes from active viral fighting to regeneration. And during this time, I'd say maybe 1 out of 10 people can get a cold sore just from suppression of their innate viral response. Local infections are quite rare, though not impossible. And we talk a lot about sterile technique in the course. I think your biggest risk is FTC action. They usually like going after bigger fish who are making a lot of money. But I would be hesitant to advertise what you're doing in any public forum, as that is a red flag or maybe a green flag for persecution by the Federal Trade Commission. Finally, we have the Federal or the Food Drug Administration, Food and Drug. And Commissioner Marks gave a little interview where he was asked about exosomes. And on the first half, he said, we're very interested in exosomes. We think they have tremendous potential. So he is working with companies to use them in certain settings. The intellectual property outlook of that is somewhat less clear. But he says, right now we're treating exosomes as the clinical practice of medicine. And then he thinks about it, and later on he says, but of course, the clinical practice of medicine is regulated by the FDA, which no person would agree with. In fact, the clinical practice of medicine is regulated by state medical boards. So if you're out there advertising and stealing other people's business and saying what they're doing is crap, and you are actually doing too well in most cases, this can raise a lot of cackles, and you might get reported to the state medical board, which has happened. So beware there. So the takeaways, like this whole Chinese food box, what are the takeaways? Well, the main lesson is this, that within the scope of the clinical practice of medicine and an informed patient-physician relationship, these MSC exosomes can provide a powerful natural enhancement to the body's ability to repair. It doesn't know it didn't make them, so you're healing like a day zero baby. Rather than a single molecule or symptom mitigation approach, the biomimicry of MSC exosomes, they can awaken dormant osis niches, meaning tendinosis, arthrosis, even nerve damage like the demyelinated nerves. We've seen that as well. They reduce inflammation and they immediately improve blood flow and viability of tissues. So in the big scheme of things, I think now with telomerase activators, which I've been using for 15 continuous years, we have this Vishnu maintenance, and now the exosomes can kind of coax new or de-differentiation replication of some damaged, burnt out stem cell niches. That's the Brahma. The senolytics have been a little more tricky because if you're killing off damaged cells, then do you have good cells to replace them? It's always a be careful of what you wish for scenario, so it's a little hard to master Shiva. But we see above here my mom at 85 who just won a jackpot at some Indian casino. She just discovered casino gambling at 84. So she went around gambling and she hit a jackpot. Ironically, I almost gave her a heart attack. She had some abnormal Q wave in one of the leads. And this Monday we did a cardiac consult. Luckily, the excitement from the jackpot didn't kill her. It was negative stress thal, negative SPECT, and normal echocardiogram. So always be careful with what you wish for. I'm very grateful. Some of you may have met my mom. She was there representing the brand, and she's a big believer. She thinks she can live a lot longer and, more importantly, healthier. At 85, she's driving at night and doing her fun stuff. Speaking of driving, we have this representation of a guy I met over the phone, Irv Gordon. He died a couple of years ago, but he had a Volvo that he had driven over 3 million miles, and he just kept on replacing the parts. So when that lady asked me, she was responsible for founding the California Stem Cell Bond Initiative, what would you do? I'd say people should be entitled to freeze their own stem cells and then use them. The future tech and deployment of these will be so much better. I mean, if you can make a MSC differentiate into all these tissue types, I'm confident that they'll be able to figure out how to replace other types as well. So 3.2 million miles in one car, not magic, just maintenance. That's coming as we get telomerase activators, stem cell banking, and exosomes can awaken or tickle back into an aroused state, if you will, these stem cells that are burnt out and tired. Unfortunately, as we interview patients in their 70s and 80s, they're often like these NASCARs. They've got all these logo stickers on them. They're on multiple drugs for multiple things or even the same thing. And once a doc adds a drug, everyone's loath to remove one. So they just acquire more and more sponsors, if you will. Next to my head is this QR code. You can scan that and you will open up the ovu.me link to me. And therein you will see two videos. One is happy patients, or maybe it's unhappy patients. And we talk about what makes people happy, what are the amazing results. And there you can download 4 years worth of educational materials. 4 meals of eating for free. If this lecture is just an appetizer, you get 4 years of every blog, every webinar, every live lecture that I've done, and most of it is very much tailored towards a lay audience, not a medical audience, and something that you can share and learn from, I hope. We had a booth at 7091, got some people there, and I just want to remind people, since we're out of the CME now, I did spend this year creating a course. It took me 5 months. Every week we did a different lecture. So there's 20 modules, and the modules are, will I get in trouble? Does this work? How much should I charge? What are the different brands to choose from? And then we go pretty much in depth. 30 to 40 minutes is the average on different areas: hips, shoulders, knees, the back, neurological treatments. Super helpful. Even treatments like cosmetic, hair restoration, genital health. We do a deep dive for clinicians who are trying to start up their practice. And there's a lot of interesting stuff on how to manage patients, how to manage expectations, how to prevent complications. All the forms I use for patient intake and for aftercare are there, downloadable, customizable. And for your retention, every 30 to 40-minute lecture has a 9-question quiz to reinforce the knowledge. If you pass the final exam of 60 questions, you get a certificate to print. And people who buy the course get the full credit back, 1,700 as credit towards purchasing exosomes. So if that's something that might interest you, it's really a toolkit for getting started, aimed at clinicians. And you can have no experience or a broad range of experience. And the best candidates are those that have already been using PRP stem cells, especially with local MSK injections. This is sort of a no-brainer. In my experience, very safe, very dosable, predictable, and hugely beneficial to most patients. So that's what I want to share with you in terms of the A4M lecture. If I do get accepted for the May Orlando lecture, it's going to be more of an inflammatory lecture and how exosomes can mitigate that. Thanks for listening. And again, contact me through my email or through this QR code, and we can get you started in the course, get started taking exosomes, experimenting on yourself, and then maybe helping your patients as well. So Dr. Ed Park, completing a repeat of a lecture I gave last weekend at the American Academy of Anti-Aging Medicine in Vegas, 2022. Cheers.